Hi folks, I'm Dr. Abdul Mannan. I'm a GP at the Hazel Valley Family Practice in Haslingden, Rosendale. It's been a busy day today, lots of phone calls coming in about the announcement last night. And so I thought I'd do a video just to try and explain and contextualise what's going on. There's a lot of confusion out there, a lot of people concerned, a lot of people asking questions, understandably. So I thought I'd make this video for the benefit of my patients, colleagues, and also perhaps the rest of our community in Rosendale and beyond. So you might have heard that the Prime Minister announced the ramping up of the COVID-19 booster vaccines, and he wants to vaccinate about 1 million people every day, which is a far greater number than the current numbers being achieved, or around about 300,000 every day. So how's he going to do that? Well, his plan is to ask GPs and the teams from primary care in the UK to get more involved with the vaccination programme in order to achieve those numbers. I guess it's a cry similar to what we did in phase 1. If you remember, when the vaccination programme started, GPs and their teams were involved at that time in greater numbers and frequency, as a result of which the UK had one of the most impressive vaccination programs in the world, and that's why we got so many people vaccinated in such a short period of time. So I guess there's a realization in government that actually we can achieve that to some extent if we get primary care and GPs more involved now. There was a reason why GPs and the teams had to back off during phase 2 of the vaccination program and allow our mass vaccination centres and pharmacy colleagues to continue the effort. Because there's also the other side to the coin, which is, even though we're doing more and more appointments in GP surgeries because of e-consults and tele-video calls and face-to-face, there's still a major problem with access to healthcare, partly because of challenges in primary care, but also because people can't access other parts of the NHS, such as our secondary care colleagues, hospitals. So there's a major crisis at the moment, but despite that, we're being asked to step up as much as we can to help with this phase of doing booster vaccinations. So we'll do our best to help out with the effort and ramp up the system. Now, the difficulty will be that it's winter. There's naturally an increasing demand on our services this time of year, and that tends to continue till about February, March. And on top of all that, how do we deliver a booster vaccination program in such great numbers? Hopefully we'll manage, but it's going to be difficult. Remember, those pressures still exist in our own workforce: fewer clinicians, fewer GPs, fewer admin staff, people leaving due to some of the abuse that's gone on lately on GP staff and colleagues. And there's illnesses as well. These colleagues also have families. They fall ill. They can suffer from winter infections just as much as anyone else, and of course COVID as well. So despite all that, there is a challenge ahead of us, and hopefully we'll meet that challenge. In Rosendale, we've been successfully operating the hub and spoke model in the past few weeks, and what I mean by that is the vaccines that came to Rosendale, we received them at the hub in Rawtenstall, and we were sending them out to our spokes, which were the practices themselves. And then the practices were delivering the vaccines from within their premises. So most of you from Rosendale will relate to that. If your practices were delivering COVID booster vaccines, they were doing it from their own premises. And that model worked very successfully. It provided a hyper-local model so that people didn't have to travel far from the various areas of Rosendale to a central location in Rawtenstall. And to date, Rosendale has delivered the most vaccines per head of population as compared to other areas in Pennine, Lancashire. We'll continue this model because it seems to provide the best access to our patients. But we are thinking about whether to get a hub opening up in Rawtenstall. That's being looked at the moment. There's no promises we can manage that. Again, it's to do with workforce and we don't even have the volunteer capacity now because a lot of people have gone back to work. So despite all of that, we're going to see if a hub will be available, but know that the spokes, the practices, will continue the work, and we'll be ramping up those spokes through the practices to deliver more vaccines over the next few weeks. Now, besides your practices, the other centres, such as the mass vaccination centres in Accrington, Blackburn and other places, the pharmacy centres as well, they'll be continuing the efforts of vaccination. So you should be able to get vaccinated through those sites as well. So really, don't wait around for anybody. If you can get booked into a local vaccination site, whether it's your GP, whether it's your pharmacy, whether it's the mass vaccination centre, just get it done. Get it done. So the question is why? Why do you need that booster? Well, we've got plenty of evidence that people who have been vaccinated, they can withstand the virus a lot better than people who haven't been vaccinated. And there's clear evidence, there's lots of evidence out there, statistics out there that shows that if you have had the vaccination, even 1 or 2 doses, your immunity, your ability to withstand the virus is a lot better than somebody who hasn't been vaccinated. That said, for people who've been vaccinated 1 or 2 doses, their level of immunity to the new variant, the Omicron variant, is a lot less than what it was with the Delta variant. However, there's clear evidence that if you have a 3rd dose, the booster, the level of immunity goes way beyond 75%. So it really shoots it back up to beyond 75%, i.e. your ability to withstand the Omicron variant will improve dramatically, and therefore prevent you from getting ill in a significant way should you get COVID-19. It should protect you from getting the virus in the first place as well. But if you do get the infection, you should be a lot well protected than you would be otherwise. Your chances of hospitalization will go down dramatically. Your chances of getting to an ICU, struggling with breathing and so forth, goes down immensely. And your chances of dying will dramatically go down. And there's clear evidence of that. We've seen research papers coming out of countries like Israel and South Africa and various other countries already. So please do get your booster as soon as you can. In terms of symptoms, what do you do? Well, the guidelines are there online. Go and have a look. If you get symptoms, do get yourself tested. If you have symptoms, lateral flow, forget them. Go and get PCR, COVID PCR testing done. That's more accurate, and we can guide you in terms of what you do next, in terms of do you go to work, do you not go to work, what about your contacts, what do they do? I won't go through all of that. It'll take too much time. Just go online and see the updated guidance on government website. Remember, to prevent COVID-19, those measures that really should have been maintained, in my opinion, over the last few months, we need to really strictly follow those guidelines, such as regular hand hygiene, if you have to cough, then into a handkerchief, throw away, that type of thing, elbows, making sure you're not coughing in front of other people and so forth. Maintaining good distancing reduces transmission. So at least 1 meters, if you can do 2 meter distancing, and masks, they should have never stopped in my view. Wear your mask if you're in a public place, if you're with people outside outside the home, if you're going into shops, anywhere public really, wear masks. It does reduce transmission. Guys, stay safe, stay well. If there's any new information, I'll try and do videos like this, but I think that's enough for now. Look after yourselves, have a lovely Christmas, and take care of yourselves. Bye bye.